Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from the Moses Lake Professional Pharmacy podcast studio. And we are super excited to have Dr. Nathan Newman on our podcast today. He is actually a pioneer in stem cells, been doing it for over 25 years. Dr. Newman, welcome to our show.
Thank you so much for having me. It's an honor to be here.
Yeah, well, so tell us a little bit about your history and where you started and how you got into stem cells and how you're here.
I come from a line of physicians. My father and my grandfather were all we have the doctor gene in our DNA. So I knew from very early on I wanted to be a physician. I loved to go and look at things. I did research when I was in college, and I went to medical school, and I became a dermatologist. When I was doing dermatology, we were doing a lot of cosmetic and we were doing a lot of surgery. So that got me interested in doing cosmetic surgery. And I did a fellowship in cosmetic surgery, doing facelifts and breast hogs and tummy tucks. And we were doing a lot of fat grafting during my training. And the fat grafting was having very poor results. And we were trying to improve it. And when I sort of discovered that there was stem cells in the fat, and the way we were improving our methods was taking better because we were actually preserving the stem cells in the fat. It was like a eureka moment for me. I understood that stem cells are the reason our products, our procedures are doing better. And I started developing a whole process of how to concentrate the stem cells found in the fat, and call that the stem cell lift. And for 25 years, I've been doing clinical research, clinical treatments in Beverly Hills in my clinic, using people's own stem cells for a variety of reasons. And I use it originally for wound care and for post-cancer reconstruction. Then I did it for cosmetic. From there, we went into wound repair and joint repair and injuries from muscle and tendons. And then I started doing autoimmune disease, especially for lichen sclerosis, which is a disease that affects women. And we got amazing results. From what I saw in the clinic, I quickly realized that the stem cells are not actually doing all the work. Is this what the stem cells are producing that's doing most of the work? So I opened up my lab and I started researching stem cells, and we really quickly realized there's a whole language that the cells are talking, and we were able to study that and decipher that, and we patented a process where we can actually take any cell, including human plant cells, and put it through this mentoring process where it gives us a specific set of factors, a specific language that now we can bottle and use it to deliver the same kind of outcomes that we were doing using platelets or using stem cells.
Wow, that's really cool and impressive. Janet, what questions do you have for Dr. Newman?
So there's a lot of people talking about stem cells now. It's kind of a hot topic out there. So I've heard so many opposing sides, good, bad, and one of the things that we heard over the weekend is that stem cells really aren't live, and that embryonic's okay. It's better than somebody's own stem cells. But I mean, so there's a lot of, pros and cons being portrayed out there. So help me with some of these myths, because, we've been told, well, no, only PRP is good. Stem cells are useless. So you probably heard some of the things. So help us with that.
So I've been doing lectures, writing books, writing articles about stem cells, and publishing our results for 25 years. First, I had to explain to doctors what stem cells were. Today, we're having discussions about what kind of stem cells.
Right.
But there's a lot of misconception about what stem cells are. First, let's talk about what stem cells are. Stem cells are the cells that renew, regenerate, and replace your damaged cells. That's their job. Every person, every being, every plant, every animal that's alive is alive because the stem cells are functioning. Your hair, your nails, your skin is renewed because of stem cells. In fact, we used to think that your brain and your fat was static, that the number that you were born with is what you're left with, and it never changes. And we know that that's not true anymore. We know that everything is dynamic. Every single cell in your body is not the same cell it was 10 years ago. It was been replaced with stem cells. If you were able to replace every single cell that is being damaged or gets old or needs to be replaced with a new cell, with your own stem cells, then you would never age. But that's not what happens. We actually age because you have more cells break down than you're able to replace them. So as long as you're alive, your stem cells are functioning.
I mean,
We
that
actually
totally
looked
makes sense. Yeah.
that's why we're alive, right?
Right.
So if
Right.
you're looking at the studies that were done on blood stem cells, there's different kinds of stem cells. You have stem cells in every part of your body. Your bone marrow stem cells is where you have the most data. 50 years of history of looking at bone marrow transplantation. We have a lot of data there. But what happens is bone marrow stem cells are there to make blood products. They're there to make your bones grow. They're there to help you grow. So it's very high when you're growing and until your 20s. After your 20s, you're no longer growing, so you don't need so many cells in your bone marrow, in your bloodstream. So they go down. The numbers go down. So people said, oh my God, at 30, you don't have any more stem cells. Forget it. Don't do it. Well, that's just not true. We did studies in stem cells in the fat, and we took it from different parts of the fat on your stomach, on your flanks. We did it on your thighs, and we looked at it on different age groups. And lo and behold, by far, there's more stem cells in the fat than there is any other tissue in the body, and that these stem cells pretty much stay very consistent over the years. So it's not like the ones in the bone marrow that you had very high levels and then they're all dropped off. They pretty much stay pretty consistent. And I've done treatments in patients who are 85 years old with their own stem cells, and they get amazing results. So this whole notion that stem cells as you age are no longer any good, that's just not true. What happens is your sort of dynamics have changed. You're not as young because things are not functioning as well. You're not optimized as well. So if we were to able to give the directions to the stem cells in a more optimal way, we're able to have them function more optimally. It's just like we age. Like a lot of people know about hormones, right? So when you age, your hormones are changing. You're not static. You don't stay the same. But if you were to give somebody who's 80 the same hormones that they had at 20, I'm not sure if that's so good for them. You don't need that. You just need to balance them for when they're at that age, not to balance them for when they were 20, because your body needs different things at the time. And the same thing is happening in the stem cell, between the stem cells. They're having a discussion. They're having this interaction between them using these exosomes and peptides and secretory factors and growth factors. And when the balance is off, well, the communication is off, well, they don't function so well. So you need to optimize them. And that's really why I learned the language of stem cells in the lab. And we started doing this work of trying to figure out how to get those sets of directions so that when we do inject them, we're able to get the optimization that we want.
So what is your most common procedure with stem cells?
Most of the people come to me still for cosmetics. So I do stem cell facelifts. Basically is using your own stem cells from your fat to undo the aging process. So we concentrate the stem cells and we're injecting it and we're sculpting this face, not just the lower face like we do with a facelift, but we're doing the entire face from the forehead all the way down to the chest, including the hands, and we're sculpting it and giving you a youthful proportion that you had, and we're increasing the number of stem cells so that we're actually having you age backwards, because we talked about it, you're able to replace the cells, you don't age. But if you're able to undo it, because we're putting so much more stem cells in one area, you're actually able to undo the aging process. You're building collagen, elastin, you're building the blood vessels that have been lost. This support structure is there. One of the first things that people notice about 4 to 6 weeks after the treatment is the changes in the quality of their skin, the color of the skin, the tone of the skin. They get that radiance back, they get that glow back in their skin. And the change is a permanent change because it's a graft. It's a live tissue that goes in and becomes part of your skin, and it will change with your skin, it will age with your skin. So you will look better in 10 years from now than you do today. And that's very different than doing a traditional facelift where we cut, we pull, we create scars. You have, risk for nerve damage. You have risk for bleeding. You're thinning out everything. You're scarring everything. It's like completely opposite of what we're doing with the stem cells.
So do you have before and after pictures of a stem cell facelift on your website?
Of course. We have...
Will you try to find those while we're chatting? So do you do some joint stuff also? That's what I've heard a lot about stem cells, is some joint stuff.
Yeah, so it's becoming very popular now, and most people are still using PRP, platelet-rich plasma. This is the pictures of before and afters. You can see I'm not cutting anything, I'm not removing anything. I'm just injecting, and you can see the regeneration of the tissues, and people are just looking younger, healthier, more vibrant. You can see the changes in their skin, the proportions, everything just looks much better. They're themselves just younger. They're themselves just healthier looking.
Do you have any picture of people's hands after doing this?
They should be in there as well, yes.
Because that one really interests me. Because I will say, as you know, I like the thought that you mentioned hands, because that's really how you can tell somebody's age, is by looking at their hands.
Yes, you used to. Now you do the hands, and you can scroll. This is lasers for the hands. It's not the same thing. It should be. If it's not there, I can send it to you guys. But
okay.
But the hands, they get very bony, very veiny. The skin gets thin. So when you inject the cells, it regenerates and makes it look a lot more youthful. Everything matches then. Your face, your neck, your hands. And going back to the joints, is that, a lot of people are using PRP, platelet-rich plasma, doesn't really have stem cells in it. It's mostly platelets. So the platelets release these factors that are wound healing factors, and they help to reduce inflammation in the long term. So it helps repair some of the damage, and a lot of people get some relief from it. But if you have like a meniscal tear, if your cartilage is torn, then you really want the cells. You want the stem cells to go in there. They have a homing mechanism. They see the damage. They go in there and they start to repair the damage that's there. And we have MRI data that shows that you can actually heal those tears. And I've done athletes, I've done older people, and we've saved a lot of people from having to do knee replacements or joint replacements. If you have arthritis, sometimes I do, the cosmetic stuff in the hands, and then people tell me, oh my God, I don't have my arthritic pain anymore. It just goes to show you how much improvement you can get, not just because I injected locally in that one spot, but anything in that area will get better. So if you don't have major damage that needs to be fixed in terms of a physical impingement, if you don't have like a bone that's crushing your nerve, then a lot of that pain is just inflammatory, and it'll go away, and you can heal it just with stem cells.
Okay, I'm gonna put you on the spot here. Okay, Dr. Newman.
I love it.
Okay. So, um, when I've heard about stem cells and PRP for male pattern baldness, and I think you're gonna, I think you're gonna be honest with me. So give it to us straight.
I don't think that we know the language yet. I don't think we understand what it what we need to turn on the growth phase of the hair. We have products that can make your hair thicker. So if you have thinning hair, fantastic. We can thicken it, we can get it to look really good, and we can probably prevent it from falling out and getting to a place where you don't have hair growth like me. But once you lose that cycle and the cycle stops to grow, we still have not figured out that language, which is what I'm working on. Because we actually came up with a product for hair, and we actually did everything to me for hair growth, and nothing was working because you don't have the hair follicles that are in active phase. If you don't have that anagen phase where the hair is growing, we still don't have that language. So we're working on that, but everything else, if you're using PRP or if you're using the stem cell factors to thicken the skin, to thicken the hair, that's works, and we've shown that, we've proven that, we've done studies on it. So if you have it, do it early so you don't lose it.
Right.
But
Right.
once you lose it, wait till we figure it out.
Well, what I think is interesting about, Jan and I have been going to health and wellness type conferences and anti-aging conferences for, 2.5 decades. And sometimes you'll have people get up there and they'll talk about this new treatment for male pattern baldness, and they're bald. So that's why I asked you the question. I knew you'd be honest.
Well, I started researching the hair because nothing was working on me.
Right.
I kept losing my hair despite the fact that I was doing minoxidil, despite the fact I was doing Propecia, despite the fact I did PRP, despite the fact I did everything else, and it wasn't happening. I even injected stem cells into my hair. I did it all, but if you catch it early, you're probably going to do much better.
So what is like for a stem cell facelift? It's definitely a less invasive, not completely non-invasive, but a less invasive procedure than a surgical facelift. So what's the typical recovery or downtime? And I mean, is your face swollen red afterwards? For how many days? Go over that process.
Of course. It's a much easier surgery than a traditional facelift because we don't have to go under general anesthesia. You don't have the risk of the cutting and the scarring and the movement of the tissue. So everything looks much more natural afterwards. There's no big risks in terms of those things. The benefit is you're taking fat from where you don't want it, and you're getting the stem cells from it, and then you're injecting it back. So it's all injection. So there's no stitches, there's no cutting. And the biggest thing is that people get swollen and some people get bruising. So that swelling and bruising can last between 2 to 3 weeks. But most people, they can probably just go out and look pretty good with, sunglasses on, and nobody would do a double take on them. At least in Beverly Hills, they won't do a double take on them. But after 2 weeks, most of the swelling goes down. At 6 weeks, it starts to look really good. And at 3 months, the cells have already grafted in, and that becomes a permanent change. But the improvement continues because, like we said, it's not just the cells, but what the cells are doing in terms of the factors that they release, in terms of the language that they have. And that language continues to improve the skin and the texture and the quality of the face for almost a year.
Janet, what questions you have?
So we touched about, I like dispelling myths because, we kind of get that within our industry. So why is there such a push for embryonic stem cells versus just using your own?
So
You've seen that, right?
It's a great question. First of all, embryonic stem cells are not being used so much because embryonic stem cells have ethical issues, and they have pragmatic issues, because we really can't control embryonic stem cells. Most people who inject embryonic stem cells, they end up with teratomas, which are little benign cancers. They try to become little humans inside of us, so it's not so good. So almost universally, most of the people who are in the regenerative world have moved away from embryonic. Now you have placental, which is not embryonic, it's just using the placenta, and you have the cord blood or cord tissue, and then you have adipose tissue and other tissues that people use. Those are thought of in terms of being youthful. And the reason they think that youthful is good is that they think of that study that showed that after 30 or 20s, your stem cells in your blood go down. So, which I just went over and I said, that's just nonsense, because that doesn't make sense in terms of the tissues. So the other thing is, when you're having fresh cells is very different than when you're having cells that are frozen. So when you take the cells from somebody else, you have to process it, you have to clean it, you have to put it in a bottle and freeze it and send it out. You're damaging some of those cells. They go into hibernation. And then once you want to use it, you have to sort of wake them up. And not all of them wake up, and not all of them do very well in terms of the injections that we want to do. So I personally think you're much better off, in my experience, using your own cells that are fresh than using cells that are frozen by somebody else. The other things you have to worry about when using cells from somebody else is if they carry any diseases. Not everything we can test for, right? We can't test for everything.
Right. Yeah. We only test for what we know, right?
And on top of that, even if you test for everything, even though we say they're immune privileged, it doesn't mean that you don't have a reaction to them. I know people who've had injections and they felt horrible afterwards. So there is a reaction to something that's not yours. It's a foreign cell. So we don't know. A lot of the data that we have is anecdotal, because there is no big studies on these things. There's not a pharmaceutical company that's coming and doing 5,000 cases here. We're doing anecdotal reports here and there, and talking to our colleagues and saying, how was your experience with it? So until we get big data, we won't know how safe it is.
So back on autologous stem cells, and it sounds like you harvest them from a patient's fat. So where do you typically get that fat?
Wherever they don't want it. So that's the bonus, right?
And then how do you get it? Like liposuction?
Mini liposuction, except it's very gentle. We want those cells alive. In liposuction, we don't care, right? We just want the cells out. In a stem cell lift, we want those cells alive. So the way we take it out is very gentle. We use special cannulas, which are basically hollow tubes that are like a needle that is not sharp. So we use the hollow needle. We go into an area that we've numbed, and we take out the fat. And then the fat that we have is sitting with stem cells in between them. So we have to separate out and release the stem cells that are sitting in between the fat cells, concentrate them, and then we inject either just those stem cells, depending on what we're treating, or we add some of the fat back to get some volume. So if you're doing a facelift, you want some of the volume to replace the volume that's been lost over the years. So it just depends what we're trying to treat. And a lot of these work together. So these cells that we're getting in the fat, we're using all of it. If you're processing some of these cells from other tissues, you lose some of the cells. Or if you're expanding them, like if you're going in the lab and say, let me get more of these mesenchymal cells, which are a specific type of stem cells, then you're losing all the other regenerative cells. So you're just ending up with one type of stem cell. And then you have to worry about if those stem cells that you grew in the lab are safe to inject or not. Do they have cancerous or other transmittable diseases?
So is the process of harvesting the stem cells and then injecting them, is that two separate appointments, or is it all same appointment?
All done in the same day. The whole thing, if you're doing the face, neck, hands, is about 4 to 5 hours. And most of that time is just waiting for things to happen. So the patient actually is not having procedure done on them for 5 hours. The face takes about 45 minutes to treat, face and neck maybe an hour, and the hands another half hour. So the harvesting, the numbing, and the harvesting of the fat also takes about 40 minutes. So the whole thing altogether is not that long, but it takes time for us to separate the cells and concentrate them. So while we're waiting for those things to happen, we do other biohacking treatments to improve the healing process and to optimize the sort of the tissues that we're going to inject in.
And this is all under local anesthesia. You're not under general anesthesia, correct?
All local. You don't need to be
Wow.
under. The hands, I don't even numb. I just numb the skin for the needle mark,
Sure.
and that's it. It's not painful.
Wow.
It's a blunt tube that just slides inside, so it doesn't hurt.
Okay, so what about women that have done all these other treatments? Because you've probably seen them. And Shawn and I have talked about this. There's a lot of different things cosmetically that people are doing. And so what about women that, or men for that matter, that have done all these fillers and things like that? How does that interact? Is that a problem?
It's a great question. So it doesn't interact because the cells are there to optimize your quality of the tissue. So it improves the blood flow, improves the collagen, elastin. It doesn't really react with the fillers. Your fillers will sort of melt away eventually. So we have to think about when was the last time that you got a filler, and how much filler did you get injected, and sort of account for that when we're doing the stem cell lift. A lot of times people come to me because they had a reaction to fillers, and they have to have those fillers. We have to melt them. We have to get rid of the reaction and then go and do the stem cells to improve the skin. If you've had a facelift already and you're not happy with the results, or you've aged and you see more changes, then that doing the stem cells is actually a great secondary treatment to the original facelift, because you don't have the risk of doing a secondary facelift. A second time doing a facelift is much more risky because everything has been shifted. You're more likely to have problems with scarring, the tissue dying, or the nerve ending being cut. So doing this is much better. Not only does it reverse some of the scarring and some of the volume that's been lost, you get back, it also it obviates the risks of having to cut again.
Wow. There's a lot to unpack here. I don't know about you, Janet, but I have learned a lot in the last 30 minutes. So
yes.
I'm sure our listeners and viewers the same. And we are streaming live on Facebook, Instagram, Rumble, LinkedIn, X, and you have a code for a discount, correct?
I don't know if you received it, but we'll make sure we'll send it to you.
Right, and I'm sure we will get that, and we will stream that code on these After the Fact live. So as we wrap this podcast up, Dr. Newman, tell us what you have a passion for.
I have a passion for educating. I really want to bring this technology that's available today, that you can benefit from today. You should know this is an option for you. It may not be the right thing for you, but you should know this is an option for you. And before you go and do traditional surgery and doing, a facelift, or if you're doing a joint replacement, or if you have autoimmune disease that's not being dealt with the medications, stem cells may be the answer for you, and you should look at that option and see if you can do it. And because not everybody can come and do the procedures, we've created a whole set of products under the stem cell line that they are plant-based stem cells that we've bottled the language to help rejuvenate and regenerate the tissues. So if you want to have that technology also as a regenerative skincare, you can benefit from that, and you can get that from my website.
And what is your website?
NathanNewmanMD.com. It's my name.com.
Awesome. Well, there you are right there. And speaking of education, the goal of, you've done a great job educating us. And the goal of our podcast is to educate and empower individuals to take charge of their own health. And you've helped us realize that goal. So thank you so much, Dr. Newman.
Thank you very much. Thank you for having me.
And listeners and viewers, thank you for tuning in to Health Solutions with Shawn and Janet Needham. Tune into our midweek podcast, Thursday, 8 a.m. to 9 a.m. Pacific Standard Time. Thank you.